One. This is my first video blog. I thought I'd make a change from writing a blog. So for the first one, I'm going to explain the difference, or hopefully, between sports massage and soft tissue therapy. I trained at the LSSM, which was originally called the London School of Sports Massage under a gentleman by the name of Mel Cash. Mel was a pioneer of sports massage and trained or worked with many famous ballet dancer and in that kind of field. He works or still works and teaches at the LSSM, but now prefers the phrase soft tissue therapy, and the qualifications that are now issued are in soft tissue therapy. He reason he went down this route was that he realised very early on in his career, having sort of coined the phrase sports massage, that actually it was relevant to many people, to the general public, if you like, or your everyday person, not just people that are doing sport. Anyone that's got a back issue, a hip issue, shoulder injury, etc., that might be picked up through their everyday work, their everyday life. And over time, it became a bit of a point of contention for Mel that sports massage was a phrase. So he's now trying to change the industry to recognise the phrase soft tissue therapy. Really, to give you a bit of a difference, you can go and get a sports massage qualification over a weekend. It's not a regulated industry, unlike sort of osteopathy or physiotherapy, but it takes a year to get a soft tissue therapy qualification. So that's not to say there aren't some fantastic sports massage people out there. Some of them have done a lot of training and have a lot of knowledge over the years. It's just worth being careful of the credentials the person who is training you or treating you has got, and make sure they've got a decent knowledge pool. Sports massage is part really of what a soft tissue therapist does, and soft tissue therapy and sports massage are all about treating the soft tissues of the body. So to give you an idea, starting with the connective tissue, the soft tissues are muscles, ligaments, tendons of the body, and as you will see, there are a really wide range of muscles. There are over 600 muscles in the body, as well as the ligaments and tendons. So if you start to have a look at those and put them on, some of those muscles are responsible for what we call fixation or stabilization. They stop you falling over, essentially, keep you upright. And some of them are responsible for movement, and many of them work together. In fact, it's very hard to isolate a single muscle, because even if you're just moving a bicep and doing a bicep curl, the rest of your muscles in the other side of your body are having to fixate to keep you balanced and stop you falling over. Because of that, because of the way the muscles are layered, as you'll have seen as I've just put them on there, it's very difficult to have an issue with a muscle that doesn't then cause a knock-on effect to other muscles. So, for example, if you had a muscle issue or a soft tissue issue in the shoulder, it can have a knock-on effect to the lower traps. We take some of those muscles off. There are rhomboids underneath. Take those off. There are erector spinae muscles underneath those, shoulder muscles, subscapularis, infraspinatus, etc. And if we spin the body round, there are other muscles in the neck and also at the front of the chest which attach on to the shoulder here. So there are so many things that can happen when you've got an injury and have a knock-on effect to other areas. Essentially, a soft tissue therapist or sports massage therapist works with those techniques or with those issues to find out what the problem is and hopefully give you a solution. So if you want to know more, if you want me to have a look at any particular problem you've got and see if we can work out together what's going on, give me a call. My number's there. It's 07980 339 864, or email me at jason@otteastbourne.com. That's my old email address, but it still works. And hopefully I'll be back soon with another video about some specific conditions and treatments. Have a good day. Cheers.